Hey, welcome to another episode of Clear Lake Connections, where we talk to the people behind the businesses of Bay Area Houston, proudly sponsored by UTMB Health. Today's guest, Dr. Nguyen, and you are with Ally Medical ER. Tell us about Ally Medical ER.
So Ally Medical ER is a freestanding emergency room. We are basically, just imagine a hospital ER, but not in a hospital or not attached to a hospital. We function in the same manner. We have imaging modality like CAT scans, ultrasound, x-rays. We have a full lab that we can provide and assess, and we have doctors. Most of them are emergency medicine trained. Others are fully boarded in other family practice that can take care of patients from the younger pediatric population all the way to the geriatric population.
So tell me how medicine's changed, because this is we've seen the rise of this model, right?
Yep.
And it wasn't very popular probably just 10, 15 years ago, but all of a sudden it's become quite popular. Tell us why and how that evolved.
So I'm not sure if you've ever been to an emergency room in the hospital.
Yeah.
Yeah. When you go to the emergency room in the hospital, you get triaged a certain way. And depending on how severe your illness is, you have to wait for a prolonged period of time. Sometimes people end up waiting for 5, 10, 15 hours in the emergency room to get seen for what they perceive as a medical condition that needs to get seen by a doctor right away. These facilities have grown in Texas and become a way for us to kind of help those people that have become frustrated with the prolonged wait time in the ER. They just want to get seen and they want their medical condition assessed immediately. And we have that capability to provide that for them. Because we're not attached to a hospital, we don't get ambulance traffic, we don't get a significant higher volume. So that's how we can see patients almost immediately upon arrival.
Yeah, and so it's the time and convenience factor that sets you guys apart.
Exactly.
So you're right. You get that ambulance traffic. Normally, if you're getting delivered by ambulance, you're going to take precedence over a broken foot or a broken bone. It's exactly the scenario I've seen play out with my daughters.
Not necessarily. Sometimes people use the ambulance incorrectly. They call the ambulance for a sprained foot. They call ambulance for a fever. And unfortunately, sometimes, when there's so many ambulance waiting, they have to see them almost immediately or triage them immediately to get seen, get the others seen that are more emergent. And so sometimes that can cause the extra delay as well in getting people assessed and seen immediately in the ER.
So did you start here or did you start in a hospital ER, your
So
career?
many of us who are emergency medicine trained, like myself, and the majority of the doctors at our facility, we go through residency, which takes about 3 to 4 years. And that's the time when we work at the hospital, a very busy trauma center, so that we can get the most experience that we can get, seeing all kinds of cases, all different pathologies, and patients from all age group and all trauma versus and medicine as well. After that, most of us sign up to work at the hospital, where we continue to master the skills that we've been taught and develop into the clinicians that we are nowadays. And then after that extensive time in the hospital, then we decide to join groups that are in the freestanding world. Some of us still actually work in the hospital setting, where we do half time in the hospital and half time in the freestanding world, like our Ally ER.
So what got you into emergency medicine?
I enjoy a lot of things. I am someone who has interest in sports. I like to read. I like to surf. I like to go snowboarding. I like various things. And so I think emergency medicine is one of the field of specialty that allows me to see all the different patients. We see pediatric, we see OB, gynecology, we see geriatric population, we see regular adult population. And so and we see them at the beginning stage of their disease, at the later stages of their disease. So that's what brought me to the specialty, and that is why I love it so much.
It's high energy.
It is.
Always on, right?
That is very true. Yep. When you're on, you're always on high alert because you don't really know what's going to come into the door at any time.
And so at your facility, you can do all of it that you would find at a hospital for the most part, correct?
For the most part, yes, except for an MRI. The hospital will have an MRI scanner. We don't, but the thing about MRI is not, you don't need an MRI right away. The CAT scan is what will allow us to diagnose a lot of the emerging conditions almost immediately. And then if we need an MRI, then at that point we provide the option for the patient to be admitted to the hospital, any hospital of their choice, because we're not affiliated with any particular hospital.
Well, and I think it's important for people to realize when they see these freestanding ERs that you guys are all certified in that field.
Exactly. Yep.
And you've got that experience. So if it's closer to your house, it's definitely more convenient.
Exactly. And of course, there should be not any fear of, you can go to an ER with a heart attack, you can go to ER with a stroke. We have all the medications, we have all the modality to help you, to prevent you from worsening your condition, stabilizing you, and almost immediately transfer you to any hospital. So that's something that we are proud of. We see strokes often, we see heart attacks often in our ER, we have a way of communicating and directing the patient almost immediately to the hospital.
And so you guys have a good working relationship with the area hospitals?
Yes, we do.
Yeah.
Yes, we do. We work closely with UTMB. We work closely with HCA. We work closely with Methodists. And so any preference that the patient may have to a particular hospital system, we can cater and provide that for them.
Because I imagine they benefit from the partnership in that you guys take some of that load off that, like you said, is causing their backups and their service issues. And so it's probably a really good, partnership that way.
I wholeheartedly believe so. That's why we have a lot of executives from the hospital system coming to us, or we meet up with them to have a discussion on how we can improve this process and this transfer that we initiate to their hospital system. And they welcome us, we welcome them, and it's a great relationship because the primary thing is just as long as the patient gets well cared for, that's all that's important, in my opinion.
Yeah, and I think that's probably a big change in medicine over the last 10 or 15 years is there's more collaboration between the different networks, between the different providers, and it sounds like this is a good example of that.
I completely agree. I think that's what more needed in medicine, because if multi-specialty gets involved in the patient care, we can have a group discussion, sit down and plan out the proper pathway to patient recovery and patient healing. And I think that's what's important. If a hospital system has the same mindset as a freestanding ER, or ER has the same mindset, we can share that with each other and we can be collegial and provide that optimized care for patients.
So were you there when Ally Medical ER was founded? Were you one of the original founders?
I was one of the original medical director
Okay.
of the Ally Clear Lake. We have since, so they originally started with Physician Premier in Corpus, and then we migrated to Houston as well as the Austin area as Physician Premier. But since we have rebranded to Ally, and I think that rebrand has improved in terms of our appearance and our connection with the community, making it more local and making it more Clear Lake, in my opinion.
And it's good that you bring that up because you guys have been very active in the community. Talk to us a little bit about what you're doing in the community and why it's important.
We are wholly invested in this community. We help out the school teachers. We improve care amongst the school nurses to navigate how we can properly care for any students that get injured. We have a strong connection with the fire department, along with the EMS system in the area, along with the police departments. We have a very strong we've basically sponsor a lot of the swim team, the basketball team, the cheerleader team from the high schools. And so we make ourselves known in the community in terms of we want to be here for the community for the long term.
Yeah, and it does. Like you said, it really makes that connection and makes you feel like you're a part of the community.
Yes, that's very true.
So what do you see on the horizon for Ally ER medical ER? I mean, what's the next thing that you'd like to see happen?
I hope that we could have another branch in the Houston area, not exactly in Clear Lake, but in the Houston or surrounding area in Pearland, where we can provide care for a more extended community. However, we want to continue to improve, continue to grow with the Clear Lake community, continue to be able to accommodate for any increased volume and increased utilization of our emergency department. That's why we're always ready to increase staff to provide the quick and efficient care that we've always been able to do.
So tell me one thing you want everybody to know about your facility that really kind of sums it all up for you?
We are very connected with our staff. If you can imagine a mom and pop shop, just imagine that as a healthcare facility. We all know each other. We go to gatherings together every quarter. We go to each other's houses to celebrate our children's birthdays. Welcome any questions regarding each other. We go visit each other's family members when they're sick, and so it's a very family-oriented facility. And we have that connection, so we continue to maintain that connection. And most of the staff have been there for many years since the beginning, myself included, our nurse manager, and pretty much 90%, 95% of our staff have remained at the facility, at the job, since they started over 6 years ago.
So it sounds like you guys have built a great culture that people want to be a part of, and it involves relationships and family.
Exactly.
That's awesome.
Yep. 100%.
Where are you guys located exactly?
We are located in Clear Lake City Boulevard, 3351 Clear Lake City Boulevard, next in the corner of HEB and in the new reserve.
Okay. I'm asking for a friend. I might need a ER one day.
Of course. Yeah, of course.
I'm accident prone, is what my wife tells me.
Hopefully nothing major.
No.
I get into these little small accidents as well. Yep.
Yeah. Well, thanks for coming on. I appreciate it.
No, thank you so much for having me. I really appreciate the time, and I really appreciate the connections that we've built with the chamber. And
Awesome.
I appreciate the support.